Well, thank you so much for joining, Monica. And I'm so excited to represent our REAIM and PRISM consortium, where we're highlighting various papers, new methodologies, etc. And your paper came across our desk, and we knew we wanted to speak with you to highlight the paper, aligning the planning, development, and implementation of complex interventions to local contexts with a health equity focus, the application of PRISM and REAIM frameworks. This paper, for those of you who haven't seen it yet, please download immediately. It has great figures and tables, and it's a real deep dive. But it was also, as the title says, complex of combining systems thinking, participatory engagement, and health equity principles. So could you really set the stage for us by giving us a bit of a soundbite about this dynamic paper?
Yes, thank you for having me and for including this latest work. This paper has been a joint effort, team effort with Ross Glasgow, Meredith Ford, and other colleagues. So it's a great piece, brand new, relatively brand new. We're in 2025, but we published in last year on continue to evolve PRISM and REAIM. As you all may know, we are encouraging us to think of REAIM as being part of PRISM, and PRISM being the contextual model added to REAIM. So in this paper, we wanted to more explicitly share, hey, here is how you can apply PRISM and REAIM if you are implementing a solution that is multi-level and in dynamics context. And how you can do that is from by using a participatory type of engagement. It needs to be hands-on with partners. It needs to be well-informed because of the nature of complex interventions, and it needs to be context-based. So that's where we are bringing the co-creation type of engagement to all things go with partners. And we put it together sequentially, as you will see in the papers, are starting with PRISM and REAIM. Then, hey, what about complex interventions, and then the co-creation. So we start putting it together piece by piece.
Yes. So could you share? So we're going to get into the positives in just a moment, but could you start us with, because we're talking about co-creation, various partners, all of these things. So could you share a little bit about some of the challenges your team faced as you brought together all three of these fields to really help advance each of them independently, and how we're using this within dissemination and implementation science?
Absolutely. That's such a great question. This field is still really evolving. We're contributing to the field of applying frameworks for complex interventions, multi-levels, and bringing different types of engagements in a concrete methodology together. How do we do that? How do we account for complex contexts? And how do we bring participatory engagement to the work? So the challenge is to move from conceptually bringing the pieces together, as we made an effort in the paper, visually and conceptually. Why do we need to bring these pieces of the puzzle together to concrete action in projects? But more, the challenge is application, tracking, and reporting, and ultimately evaluation.
Mhm.
Currently, to my knowledge, we don't have a way of evaluating a co-creation type of engagement. For example, we're working on that. We don't have yet validated measures. We're working on that. So it's a work in progress, but that's where we're heading. We wanted to start with this paper mostly crafting the way of conceptually how will it work. Here are the steps, and how to apply PRISM and REAIM from these two perspectives. And we started with the illustration in a concrete case study, a pilot project that we have been working on. But we are still, the challenge is moving forward, and in the areas that I shared with you, tracking, monitoring, and reporting, all
Mhm.
these pieces, how they're working together. That is still a challenge.
Yeah, I can see that. And what one of the things from the paper that's so important, because we find a lot of folks who visit re-aim.org or prismtool.org that these visuals are so important. And so you've taken PRISM and added health equity considerations. And I love that you've said you're trying to make it more concrete because I think a lot of people doing participatory work or trying to advance complex interventions in various settings are thinking about these things, but it's kind of what's the step-by-step process, and then how does that relate to each domain within PRISM and to all of the REAIM outcomes. So, can you share the next piece beyond the figure that we hope that everybody will go look at and maybe adapt for their work? There's also this matrix, this co-creation matrix that has different engagement strategies, and you walk through the different functions that you might be targeting and then forms that that might take in the real world. Could you explain a little bit more about how you created this table and what you want readers or people who would apply this to understand about forms and functions and as it relates to PRISM and REAIM?
Correct, yes. So there are two concepts I've been working on with other colleagues such as Brian Midman, Penny Hall as well. She coined the terms of functions and forms as one way of conceptualizing and mapping multi-level interventions. Functions, in a nutshell, are the purposes that are theory informed on how are we bringing about change. In the literature, you might have heard about components. There's some debate, are the same as functions or not, but it's very similar. So the functions are in our interventions. It could be a clinical or public health intervention as the thing, or a strategy as an intervention.
Mhm.
What is the process of change? Knowledge transfer, for example, for a strategy. Um, the core function for that strategy will be to increase knowledge about something. So that is a standard, and that is something that where we can pull from PRISM, from the four buckets on infrastructure for sustainment, the characteristics of intervention, characteristics of patients, for example, to inform those purposes, those core functions. But that is a standard, our goals. So for a type of intervention, we all should agree on the same purposes or goal. Increase knowledge on diabetes, for example. Even if you, Samantha, are implementing the same program in another county, state, country, we both share that purpose as, hey, when we increase knowledge, we're going to make these promote these changes related to diabetes, for example, for the thing. But then it comes a more flexible approach in terms of how do we are going to carry out those functions, because functions are very abstract, conceptual. So
Mhm.
again, it's all about operationalizing these very abstract concepts. The forms can be strategies. That what are the actions, workflows, strategies that are going to help us meet that goal? We started with 2019, a paper published in the Journal of General Internal Medicine with Brian Midman, Rebecca Langning Hall. If you all are interested, I recommend you check it out, where we use concepts of functions and forms specifically applied to patient-centered medical homes, and we develop a matrix. You can do that with your partners, and on our website in functions and forms, there's concrete guidance on how to do it. But in a nutshell, when you sit with your partners, as we do that contextual assessment guided by EPIs, or in this case, PRISM, you ask your partners from your context, could be a hospital, a school, what are the needs here? What
Mhm.
do we need this program to begin with? And you start writing it down and ask, okay, in a table, could be Excel table or a PDF fillable form. For this need, what will be our purpose, our core goal that we want to achieve? And then how are we going to do it? What will work for us to do
Mhm.
it here? What are the actions or workflows? But you write it down and you kind of align it with each of the needs and each of the purposes with the specific forms. And then you have a map, you have a matrix, you have a table that you can use with your partners to visualize what before was very abstract. Now you have a table with concrete needs, purposes, and actions. You can include a column of notes
Mhm.
if needed. And you can use that. I have used that table for monitoring, tracking, and monitoring.
Mhm.
So during coaching sessions with care teams in community clinics, we bring the table and say, okay, remember we had this need and this was our goal or purpose. I never say core function. Partners say this was our
That's what I
purpose
was
or
gonna
goal.
ask.
That
Mm-hmm.
one word is not that precise, but I
Mm-hmm.
can give them the whole definition. And then
Mm-hmm.
I say, is this still a priority for this clinic, for this school? Yes or no? What has changed? And here are the activities, the how we are going to do it. Has anything changed? But I use the matrix
Mm-hmm.
to say we developed this as a team during the preparation phase. For example, if I'm using EPIS, PRISM guide me on the buckets where to look and how to organize my matrix. And then I can monitor and keep track of adaptations or deviations and any changes in the systems because they're dynamic. So that's how we have used functions and forms in terms of a matrix, and always doing it based on the literature, informed by the literature, but also informed by our partners.
I love how you keep going back to this is concrete. This is and even in the translation, right? That was going to be one of my follow-up questions was are you using these terms, forms, and functions? But it's like this is the purpose, this is our goal, is this meeting it? And it gives you an activity or a strategy. So that is really helpful as we continue to think about co-creation. And then I'm assuming a lot of the folks that might be watching this or listening are folks who might be using this paper to inform perhaps something like a grant proposal. And I would say, what I also heard you say was that these functions align with the theoretical underpinnings. I think when we start throwing spaghetti at the wall and saying, well, we don't know and we're co-creating or it's participatory, so we're just going to dance with what works. Some people think that that's not real science, but it's that evolution, that iterative nature, that co-creation in the real world and giving stop points to say, this was our goal, did this work, and what do we need to do to pivot? So I think that's really important. And I hope some folks can really use some of the tables and figures from your paper to guide some of their future work as well.
I agree. I have often conversations with Penny Hodges in Australia. Again, she coined these terms, and I admire her work. And I always ask her, how do we identify core functions? I do it more from the pragmatic aspect using matrices and the approach, the methods. But something very helpful that she said has been think of your theory. What is your theory telling you how you're going to achieve change? The theory is telling you you need to do A, B, and C to bring about change. Those are your core functions. Increase self-efficacy, increase knowledge base. Those are the core functions that we need to really hold on, bring them into practice, and in these matrices that pair concrete actions are very helpful to make sure we're engaging those mechanisms of change.
Yes. So speaking of mechanisms of change, my next question is related to hypotheses and how do we see um, co-creation. I know you mentioned earlier in the challenges section, there's still challenges of capturing the adaptations, a lack of validated measures, these types of things. But it doesn't mean it's not important. We don't want to wait 5 years for some of these tools or resources to exist, but we still want to promote co-creation as an important part of advancing the individual fields, the collective fields. So could you share a little bit more about kind of your vision for co-creation as it informs both kind of the clinical or behavioral intervention as well as the implementation intervention, or just something you would, if you had the ear of a program officer, something you might want them to hear, something like that. Just a little bit about your vision for how you see co-creation informing hypotheses and funding announcements.
Yes, thank you for that question. Yes, I am very passionate of all things go with our partners. If we think of a continuum of engagement, we see on the left when we engage with our partners more of an advisory role, which is very important by all means. But also there are two areas. In implementation science is all about a main premise for us is to understand and be responsive to local context so we
Hmm.
can tailor to context. And second, that we better inform the strategies with the characteristics of that context. Otherwise, that's not going to work. It's not going to be feasible, actionable, and sustainable. That means we need a type of engagement that aligns with those goals, with those tenants, key areas in our field, the D&I field. A type of engagement, and that is a co-creation type of engagement, aligns so well with this type of, again, goals in the field and concrete areas that we're developing, strategies and contextual assessments. So it can be very helpful. We have a paper on co-creation principles already from a literature review on application to implementation science. We have this paper where we are highlighting the type of engagement to inform that PRISM kind of context assessment on identifying functions and suitable, actionable, feasible forms. But the how is not there. How do we do that? Okay, bring your partners. That sounds great, but how do we do it? So co-creation, I include them in my grant proposals, especially on AIM-1 as the methodology for the type of engagement that I'm going to promote to reach those goals, to refine or develop strategies and to better inform and understand local context. So co-creation can serve our research early on during preparation phases. We're thinking on EPIs. PRISM, as we understand the four buckets, as I call them, or categories of context, from PRISM to help us increase reach, adoption, implementation, and sustainment. And I include them in that first aim. This is my type of engagement that I'm going to promote. Here are the principles, and I cite our paper that I'm going to promote. How we're going to do it, Amy Hutchman and Russ and others, we have been working on a concrete method, which is workshops.
Yep.
So we have implemented working sessions with clinical personnel and patients when we start from the beginning and we bring from the literature and the evidence and say, patients, here are our goals for this. This is an online screening tool. Here is what we want to do. Here are the purposes: increase, maintain, engage. And we present the core functions to them and we say, what do you think? Are we missing anything? That's the type of engagement on refining and assessing the relevance of core functions that co-creation can bring. Then we bring, okay, here are some potential actions in terms of workflow or how patients, how do you want to see the app? Do you want to see it in paper? Do you want to see it in, do you want to log in your patient portal? What could be possible? And how do we make it work for different preferences, which are the forms? So we present that and we start working with them throughout the sessions of refining workflows. So we have used process mapping, user testing, sessions on different prototypes, but we are co-creating that knowledge and the direction of where we're heading. That's the type of engagement that can help us reach those two goals. Coming back from my initial point, understanding and being responsive to local context, and then developing those strategies that are very well informed by those members of those systems, those communities. Otherwise, our goal of making solutions feasible, actionable, implemented with fidelity and sustainable is not going to happen as well as we hope to.
I know it's so surprising. We're filming this in 2025, and it feels like we really have to understand that engaging and listening and understanding what the system and context and people behind the system actually want. It's that constant push-pull. And when we're in this like publish or perish and thinking, I need my next grant or paper or this, and we leave out communities or facilitators, we're missing the point. And this co-creation can be such a valuable way to get there. And as the whole paper is about to increase health equity and sustainability. So, and that's where I still always lean so much on Ream and Prism because it's always been about health equity. It's never been just did it work? It's for whom, under what conditions, and how does it work? And how do we start mapping, measuring, being nimble and responsive and constantly in that co-creation conversation. So I so appreciate everything you've shared with us today.
I agree. I wanted to share, if I may, share our table and let's highlight a little bit on in terms of health, health equity, equitable and representative outcomes, I wanted to share the table that we present in the paper as we put the pieces together. This is kind of toward the end. So here in the middle, you see the prism. This is one way of depicting the prism. We have many different formats or versions, but we have the contextual factors that these factors should inform our core functions of the thing, like clinical intervention, diabetes, but also the strategies. The strategies are also an intervention. And they also have a purpose, knowledge transfer, for example, increase knowledge on certain areas for the strategy. So when we inform the purpose and how we do it, how we carry out those purposes by context informed by PRISM, is more likely that we're going to reach the bottom. We're going to increase those outcomes. But as you see on the sides are concrete prompts to have in mind throughout the journey in terms of health disparities as a field of study in the United States for decades and decades. For example, as part of understanding and thinking of multi-sector perspective on my particular solution, I can ask my partners, what is the history of this? What is the structural drivers for this policy? What are the challenges? What are the assets? Are we including many perspectives to understand these external factors? And then as we do that, the type of engagement should permeate from the beginning, understanding those contexts, informing functions and forms, and then defining, assessing, and reporting on outcomes by a type of engagement where our partners, all things co-produce or co-create. We treat it as the synonyms, or co-design a particular aspect of this process. Could be co-designing an app, health app, or the full intervention. But that type of engagement should permeate from beginning to end. That's how we promote health equity in terms of having the voices, having being better informed and honoring those perspectives and diverse backgrounds, geographic locations that are represented for our partners. But just because we sit at the table doesn't mean we're really incorporating their knowledge and their preferences. So the type of engagement we need to push further, and we really need to make sure we're on the right side of that continuum of engagement, that we are co-creating the new knowledge, the direction of where we're heading throughout this process. And we can start all over again. We can assess and say, okay, we need to go back and better understand context or adapt to a new one. Are the functions the same? They should, but let's review. The forms are going to be different, most likely. How are we defining outcomes? Perhaps reach is defined differently in this new setting, but this is kind of a recurring cycle for us as implementation scientists.
Thank you for walking us through that and highlighting it. And I will just wrap with, you've gifted us with so many great words. I love that you said this should be permeating the entire process. I love that you've reminded us that we're moving from theoretical to concrete, that it needs to be strategic, but that it always needs to be on that engagement continuum to understand context and settings. And I love what you mentioned. It could be anything from an app to an infographic, like whatever we're producing, why would we not co-produce? And so I really appreciate your work. We will definitely highlight some of the other papers that you mentioned, because collectively we can start to see that becoming something that more people feel confident in facilitating and then evaluating, and then we learn more and more from each other. So thank you so much for being here with us, and we can't wait to disseminate this in one more way.
Perfect. Thank you, Samantha, for highlighting these efforts. It's a work in progress, team effort, and we want to keep learning from others who are pulling from these ideas, testing it, getting back to us. This is all about team-based science. Thank you, Samantha.
Absolutely. Thank you.